Hi, this is Dr. Farley. I want to go over with you today the weekly blog. And today we were just having a conversation about the idea of false hope and where these concepts even come from. And I will tell you that there's two areas that we see these concepts come from. If your only opportunity to try to get better is a drug that doesn't restore normal function, then you should not have major hope, because you're not going after how things work. And the power that made the body, that can possibly heal the body, is not fully expressing itself because the drug did nothing to enhance that. So of course there may be false hope there. We also may look at chronic cases, whether that's depression, anxiety, bipolar, schizophrenia, PTSD, thyroid issues, Parkinson's, Alzheimer's, MSA, multiple sclerosis, whatever it may be. And if all we've tried are the drugs again, and we don't see a result, then I would agree that that person should not give you any false hope, because they don't work. On the flip side of that, if we're going after how things work, which is the gears, and looking at, for you specifically, through proper testing, then we get a proper root functional cause diagnosis, what's not working, and then lastly we set up a plan to correct what's not working, then there is no such thing as false hope. It's a ridiculous concept. You're only going to give the opportunity of the system to start to work. We don't guarantee results, but 91% of our patients in 2 to 4 weeks will report back to us that they feel better in multiple different ways of their top chief complaints. So we never provide false hope here. We only provide hope if there's an opportunity to restore function. And for most patients, there's usually an opportunity to restore function. Another big thing to point out here also is you have to do your part in my office here. If we tell you that you have to do X, Y, and Z, you need to do your part. If you don't do your part and then you come back and you say, hey, this didn't work, well, most of the time we're going to turn the mirror around and say, hey, take a look in the mirror. Are you doing what you need to do to get you where you need to go? And most of the time, that's where the problem lies. In less than 9% of the patients, 5% of the patients, we can't figure out how to get you some type of a result. Most of it, if it's a failure, comes from the patient not following through on what they need to do on their own end. So thank you. I hope you found this interesting, and we will provide results for you and opportunities to heal, and focusing on how things function and restoring function so that you can live to a higher level mentally and physically. Thank you.